John, let's just stop for 1 second though and talk about this marijuana cannabis-induced psychosis.
Yeah.
This is something that we are seeing a lot on Hanley's campus. Do you want to talk about this a little bit, or?
Well, I know that we get calls from family members, and if we ask them, is there drug use involved, they might not think about the cannabis
That's
part.
right. Medical professionals might not.
Yeah, that's right.
And so, for some people, if they have a genetic predisposition to psychosis, and then you use a substance like cannabis, it can actually trigger those symptoms.
It was about 8 or 9 years ago, maybe even longer, that I saw a patient with cannabis-induced psychosis, which it wasn't even called that back then. There wasn't so it was probably longer than 19 years ago. But I remember him very distinctly. He was a young man in his 20s. And he, all reports, he'd had a psychotic break. He's a Wall Street guy, very successful, well-educated, no history of anything that people knew of, but high dose, high frequency THC ever since, he was about 14. And I didn't believe, no one did. He said the only thing, he didn't even drink alcohol, nothing. And the family confirmed it. The drug tests confirm it. Everything. We didn't believe it. We thought, no, there's gotta be something. You're partying with some drug that we're not finding. And because nobody 15 years ago, even less than that
time, that's
had any idea that the psychoactive drug in marijuana, THC, it is not, your dad's joint anymore, right? So, mom and dad in the 80s were smoking joints and they were getting 5 to 7%, maybe. Today you can go and you can get a vape with almost 100% THC.
That's right.
It is, and the high frequency, high dose we nowadays
have in our inpatient mental health program at least one patient presenting with this almost all the time. Now, the good news is, and these are most all the time young people, usually under 30, they've, we're getting them back, but it's taking months and months. I mean, it is very dangerous. Very, very dangerous.
I think a lot needs to be done for the prevention and the education on it. I think just a lot of people see it as innocuous and don't realize that this could be a trigger and it could be something that is making the problem worse.
Especially when it's called medical marijuana.